Seizure disorders affect the nervous system. The condition causes its bearers to seize up and convulse with varying degrees of severity. Epilepsy is an umbrella term for a variety of seizure disorders. Humans have been aware of this condition for over 3,000 years, historically described as a loss of consciousness. It can be difficult to diagnose before a seizing episode actually happens, which can be triggered by rapidly changing light patterns, drug and alcohol abuse, and emotional stress. Even people without epilepsy can suffer seizures. Epilepsy is typically diagnosed after an individual has a seizure that was not induced by drugs or alcohol. Not all of seizing causes are known, and some are unique to particular types of seizures. Some of these causes include genetics, brain trauma, brain cancer, stroke, and drug and alcohol abuse. It affects about 1% of the Earth's population, mostly in developing countries. All age groups can suffer from it, and it usually happens and first appears in infancy, childhood, young adulthood, or in the elderly. The types of seizures are partial and generalized. Partial seizures, also known as focal seizures, take place in a single or possibly multiple parts of the brain at once. These seizures are divided as simple and complex. A simple partial is characterized by no loss of consciousness or memory after the seizure is over. This type of seizure involves loss of motor control and the distortion of senses and perception. Sufferers may twitch temporarily or possibly see, hear, or smell things which are not present. A complex partial is defined by the loss of memory and consciousness in the afflicted person. These types of seizures are typically accompanied with feelings like déjà vu or nausea, as well as particular random actions that can signal an oncoming seizure. These actions can be something like nonsensically repeated words and phrases, fumbling of the hands, lip smacking, or tugging on clothing. These are called automatisms. 75% of people with complex partial seizures have automatisms, while the remaining 25% simply blank out and cease all activity for a few seconds to a minute before the seizure takes place. Head trauma, infection, stroke, vascular deformities, tumors, dysplasia, and scarring to the inner lobe of the brain are all common causes. Generalized seizures affect each hemisphere of the brain simultaneously. Some of these conditions may have a starting focal point, but the effect then spreads over the rest of the brain, whereas partial seizures stay on the focal point. The causes for this type of seizure include metabolic issues, negative reactions to medication, genetics, and photosensitivity. There are 5 categories of generalized seizures, which include absence seizures, tonic-clonic, myoclonic, atonic, and tonic. Absence seizures typically affect a person during childhood, but sometimes carry over to adulthood. Those suffering absence seizures will display staring spells which will last for several seconds, some of which will be accompanied with eyelid fluttering and head nodding. Tonic-clonic seizures are characterized by a sudden loss of consciousness and get their name from the stiffening, which is the tonic activity, and rhythmic jerking, which is the clonic activity, that sufferers will display when seizing. Often at the start of these seizures, the sufferer's eyes will roll back and they will let out a brief cry due to the stiffening of respiratory muscles in their throat. These seizures typically last 1 to 3 minutes. A myoclonic seizure is a singular jerk movement or a short burst of multiple jerks. These are distinguished from the tonic-clonic movements due to their lack of organized rhythm. Atonic seizures cause their sufferers to suddenly drop to the ground limp. These types of seizures are often found in children and adults with heavy brain injuries. Some sufferers must wear football helmets in order to prevent further damage during a seizing episode. Tonic seizures will stiffen the sufferer's muscles. Legs or arms expand out, and consciousness may or may not be lost during the episode. These seizures are distinguished by their lack of clonic movement, but can be hard to diagnose since other, more common seizure types may sometimes not have myoclonic activity either. In addition to the number of seizure types, there are also a number of epilepsy classifications. Localization-related epilepsy is a specific condition for partial seizures. Infantile spasms, also known as West syndrome, are characteristic to infants and toddlers. The ages range from 3 months to 3 years. This form of epilepsy causes sudden spasms and a high risk of brain damage. Benign Rolandic epilepsy typically afflicts children and teenagers between the ages of 6 and 16 years old. This form is characterized by the region of the brain in which it begins, the Rolandic region. This area is associated with the brain's motor sensory junction. The seizures caused by this condition will typically make the face or hands twitch or tingle and frequently happen as the sufferer falls asleep. This type of epilepsy is considered benign due to the high chance that the seizures will leave by the age of 21. Juvenile myoclonic epilepsy is the most common seizure disorder in young adults. This condition is genetic, tied to chromosome 6 and, in some cases, chromosome 20. It causes limbs to jerk and sometimes tonic-clonic seizures. Unlike benign Rolandic epilepsy, the chance to outgrow juvenile myoclonic epilepsy is very low. Febrile seizures are spawned by fever. It is considered an epileptic syndrome in toddlers and children between 6 months and 6 years old. It can be difficult to diagnose because some illnesses can trigger seizures without the febrile disorder present. The majority of children with febrile seizures are at low risk for carrying epilepsy later on in life. Lennox-Gastaut syndrome is a somewhat rare form of epilepsy in which there are multiple seizure types and differing levels of permanent cognitive impairment, but possibly none at all. It affects children mostly, but some adults suffer from it as well. Treatment for Lennox-Gastaut is difficult, with only 10 to 20% of those treated showing satisfactory improvement. False seizures can be caused by other diseases, conditions, and some psychological issues. These may appear to be seizure-like, but are considered separate from epileptic conditions and actual seizure conditions. One of the most confusing of these is the psychogenic non-epileptic seizure, also known as PNES, and it's an event in which the individual has no control over. These occur with aberrations in the electrical discharges in the brain, often triggered by stress. PNES events have symptoms like headaches, ulcers, rashes, shaking, and blackouts. Although these can be mistaken as seizures, these are not considered seizures. There are a few different tests a doctor can perform to see if an individual is epileptic. Blood tests detect possible infection, metabolic, or chemical sources for seizures. X-rays, magnetic resonance imaging, and CT scans of the brain can show tumors, blood clots, damaged blood vessels, abscesses, and other structural damage that could produce seizures. An electroencephalogram, or EEG, is particularly useful in diagnosing epilepsy due to the fact that it can measure the electrical activity going on in the brain. Electrical patterns are visibly different between normal brains and epileptic brains. However, many people have abnormal spikes in their electrical activity, and an EEG should never be the sole tool used to diagnose epilepsy. Due to the variety, levels of severity, and possibility of conditions being outgrown, medicating and treating seizures and epilepsy is complicated. There are a number of surgeries and medications that can treat or cure these issues. Anti-epileptic drugs do not cure, they merely suppress and potentially stop the frequency of seizing episodes. There are many different generic pills available, each with a number of pros and cons. All of these drugs, however, have a suicide warning on their labels due to the common side effect of severe depression in their users. Many of these drugs also lower blood cell counts, which can lead to other health issues. Statistically, these medications help every 2 out of 3 people with epilepsy. Cases that cannot be subdued with medication are known as refractory epilepsy. Refractory epileptics may turn to surgery. If an individual's type of epilepsy has a single focal point in an area safe to remove, they are considered good candidates for the operation. This procedure costs upwards of $50,000 in the United States. There are also two methods that may reduce the risk of seizure. A ketogenic diet, which limits carbohydrates and is high in fat and protein. It changes the body chemistry to make the brain more resilient towards seizures. Children under the age of 12 are most likely to benefit from the diet, though it does work with some adults. Negative effects of the diet include high cholesterol, stunted growth, and weakened bones. A biofeedback machine is designed to help relax those who suffer from seizures. These can help prevent seizures, although this has not been proven in scientific studies. Research on anti-seizure medication is probably the best bet to prevent seizures. Hopefully in the future, a safe and efficient pill will be made available. Thank you.